to raise awareness about diabetes, because India is the second largest country after China in terms of numbers of diabetics. What is even more alarming is that we have an even greater number of pre-diabetics who will soon become diabetics if we do not institute certain lifestyle changes. Diabetes is a disease that is detected by a blood test, wherein if the fasting is more than 126 milligram percent, and if the 2 hour post meal of 75 gram glucose load is more than 200 milligram percent. Also, if you have an HbA1c level of more than 6.5%. You did ask me, why are we so concerned about diabetes? Because diabetes is essentially a chronic disease with blood sugars that are raised either due to less insulin secreted by the pancreas, or if the insulin resistance is present, especially in obese and fat diabetics. So it is essentially a blood test. Why are we worried about diabetes? Because, as you know, diabetes has many complications, mainly affecting the eye, the heart, the kidneys. Many people with diabetes more than 20 years would eventually need a dialysis or a renal transplant, and these are treatments that we can ill afford among our patients because of the expenses involved, and also the morbidity and the suffering that they undergo. So essentially, diabetes is a chronic complication with multiple complications that arise if you have diabetes, and the best way to control these or prevent is to treat your diabetes well. Keep your HbA1c below 7%. If you have diabetes, you cannot eat fried foods. That's a good question, because everybody everywhere in India loves fried food. So what we say is, do not have deep fried food. But there are other methods of frying food. You can saute the food with a very little bit of oil. You can make it with even on non-stick dishes where you use just a spray of oil. Or you can, stir fry your foods like they do in Chinese food. So it's a good way of making vegetables and non-veg items by just stir frying them. However, you do need to cook them a little longer. So deep fried foods are a no for diabetics, but definitely other methods of frying, sauteing are acceptable, and they also provide taste to food.